guys, welcome back to my channel, or if you're new here, welcome. Today I'm doing a video on gastroparesis. Gastroparesis basically means that the stomach is paralyzed. If you break the word gastroparesis up, it translates to stomach paralysis. Everyone has a different motility rate, which is the rate that your stomach empties, and some people have it worse than others, but basically the concept is that the stomach muscles don't move, so the food that the person or patient eats just sits in their stomach. And the same thing with fluids or literally anything that they ingest, it just sits in their stomach for a longer amount of time than normal. And so the more time that it sits in the stomach, the more pain it causes, the more symptoms it causes. What are some of the symptoms of gastroparesis? So a lot of the symptoms are just general GI symptoms, so nausea, vomiting, bloating, regurgitation, reflux, weight gain, weight loss. There can be malnutrition associated because the person can't eat because the stomach, the food just sits in the stomach, and because the food just sits in the stomach, they have issues with feeling full too early, feeling full after eating 2 or 3 bites of food, there's so many symptoms. There's a ton of symptoms, and none of them are very pleasant at all. How is gastroparesis tested for? So there's a couple tests that doctors do for testing for gastroparesis. One of them is a gastric emptying study, and so I'll do a video on that later, but basically you eat food and then there's a radioactive isotope in the food that you eat, and there's a tube that takes pictures of your stomach as the food is digested, and it tells you what % of food is still left in the stomach after the 4 hours. Hypothetically, there should be less than 10% left in the stomach. People with mild gastroparesis have 10 to 15% still left in the stomach. People with moderate gastroparesis have 15 to 35% stuff stuck in their stomach still, and then severe gastroparesis is over 35%. Another test they do is manometry testing, which is where they put electrodes in a tube similar to this one. It's wider, but it's the same concept. The electrodes go down and they attach to the stomach wall and then down the esophagus, and I think the first part of the small intestine as well. And that's called an antroduodenal manometry test. I'll write it. It will show the electrical currents going through the stomach muscles as the test is performed. It's similar to a EKG, except it's for your stomach and your intestine, or the first part of your intestines and the esophagus, but it's the same concept. What are some treatment options for gastroparesis? So usually the first line of treatment is a diet change, and so your doctor might have you cut out dairy or fats or high fiber foods, red meats, just things in general that are more difficult for bodies to digest, because when you can't digest, putting stuff in that is more difficult kind of defeats the purpose of trying to get better. So that's kind of the first step. And then if the person is so symptomatic that they can't maintain on their own, they could get a feeding tube. They usually prescribe nausea meds or something like that to sort of help some of the symptoms, and it's really mostly about managing symptoms, but it really just depends on the patient. And so if nausea meds don't work enough to get the patient the adequate nutrition they need, they may be given a feeding tube. There are multiple kinds of feeding tubes. So I have an NJ tube, which means it goes down my nose, down into my, past my stomach and into my small intestines, and feeds me there, and it's called a post-pyloric tube because the pylorus is the sphincter in the stomach that opens and closes and allows food to go through. And with someone with gastroparesis, since the stomach muscles don't move, the opening doesn't open. And so since this goes past the pylorus, it's not really an issue anymore. I mean, I still have symptoms, but they're definitely not as severe as they were, and I'm getting the nutrition I need. People also are able to do NG tubes, which goes to the stomach, and slower rate helps them manage their gastroparesis. And it's like a really good option for some people. And then if you need the tube for long enough, it can be made a surgical tube, so it goes straight through the abdomen into the different area of the abdomen. Patients with gastroparesis get 2 tubes, and one goes to the intestines and the other goes to the stomach. And so the one that goes to the intestines is used to give food, and the one that goes to the stomach, they don't necessarily throw up as much, or it helps with bloating because it gets rid of the air that's caught. It's a really good option for some patients. I don't have that. I don't need that right now. And I hope I never will. They also usually, if it's severe enough, they will prescribe medications. So the first medication they'll usually prescribe is an anti-nausea medication, so that would be like Zofran or something along those lines. If that doesn't work and they need to do something that's a prokinetic, which helps the stomach move, there are 3 main options, but there are also other options that are just not as like most commonly used, or like the first line of treatment. The first line is 3 medications, erythromycin, Reglan, and domperidone. And those are all medications that hypothetically will help get the stomach move well enough to get the patient to a place where they can hopefully start eating even a little bit by mouth, or a little bit more by mouth, because even a small amount of progress is progress. Another option, if it's severe enough, is surgical options. There are a couple different surgeries. I'm only going to mention a couple of them, but there's more that I won't mention. One of them being Botox injections in the pylorus and like the muscles around it, and that is to keep the pylorus open so that the food can go through how it's supposed to, so that it just stays open. And that's also a really good treatment option for some people. Another one is the G-POEM, which is where they actually make an incision to keep the pylorus open. They like cut the muscle so that it can't close. And that's also helpful for some people, but like everyone knows, every body is different, and so treatment like really varies. Another possibility is a gastric pacemaker. So it's like when they put a pacemaker in the heart and it just tells the stomach to contract or to move. And that can also provide really good symptomatic relief for some patients. I'll make a video in the future about my experience with a gastric emptying study and what a gastric emptying study is. I'll go into more detail about it. And I will also make a video about how I was diagnosed with gastroparesis in general, like my symptoms and how long it took for diagnosis and that kind of stuff. I have a couple more videos, I have quite a few actually, videos lined up, so I'm hoping to be more active on here. But yeah, thank you for watching, and I'll see you in my next video. Bye!